When I was 15 years old, after 2 years of my lupus diagnosis, I started complaining of severe headaches, severe migraines, vomiting, bleeding from my nose. I was then taken to a neurologist. After years, I learned that one of the top manifestations of lupus is the neurological one. Lupus can affect any organ, but it largely affects the brain, the spine, and the various aspects of the nervous system. When I first met Dr. Mathew Abraham, he recited a poem by Rudyard Kipling called If. Dr. Mathew personifies excellent patient, Dr. rapport and warmth. It's an honor to have you here with us, Doctor. Welcome.
Hello.
Hello, Doctor. Welcome.
Hello.
It's an honor and a privilege to have you here with us today.
My pleasure.
Doctor, one of the top manifestations of lupus after nephro is neuro manifestations. Lupus affects any organ, but when it affects the brain or the spine, it's a major concern. It's a huge concern, and it causes anxiety, and sometimes we have also learned that it's now called Neuro-Psychiatric Lupus as well. Like there is its connections. Could you please tell us how does lupus affect the neuro point of view, and what are the treatments that are available right now?
Lupus essentially comes from the word wolf, and essentially it is the immune system going wrong. The beauty of the immune system is that it can identify what belongs to itself and what is foreign. And this sort of identification pattern is stamped very early in fetal life. There is probably a cutoff period in fetal life beyond which any substance, any tissue, any organ, anything infective which has not been given that stamp of belonging to oneself becomes recognized as foreign by the immune system. Now, therefore, the immune system of the body will never attack its own tissues, what it identifies as its own. What happens in lupus and in these autoimmune diseases is essentially that there is a case of mistaken identity, as a result of which the body's immune system attacks its own tissues. That can manifest in different ways, depending upon which tissue the attack is targeted at. The commonest one which people understand is rheumatoid arthritis, which many people think is only involving the joints, and that is the commonest one, people understand it. But it can affect other systems also.
Including the heart, I understand.
Absolutely. Heart, the lungs, it can be affected, the nerves can be affected. But that is a common thing which people would understand. But you can have different types of immune attack, and lupus is one which attacks practically any system. And like you said, the kidney is the one that is most commonly affected. Probably joints would be next. But the brain is a pretty common target. And within the brain, it can affect any of the systems in the brain. It can be the nerves of the brain, it can be the arteries of the brain, it can be the veins of the brain, it can be the meninges, which produces a meningitis, it can be the spinal cord, it can be the peripheral nerves, or combinations of these in various proportions. But the commonest one that you often get is the arteries getting affected, where you get strokes in relatively young people. Now, strokes is something that you usually relate with older people. It's an old age disease. But here you have a young person who comes to you with a stroke.
Absolutely, doctor, because lupus affects the young population.
Yes, yeah. That's right. So it can present as a standard stroke, except that it's a red flag when a patient who's young develops it. So we don't look at the common risk factors which we look for in older people, in those patients. And that is why the whole focus of investigations would be to find out whether there is an autoimmune process like lupus which may be affecting. Just as much, or probably just below that, would be that the veins get affected. So you have what is known as CVTs, the cortical venous thrombosis. The veins get blocked, and sometimes the effects of that can be even more disastrous than an arterial stroke. because the outlets are blocked. So the amount of swelling that it produces in the brain can be quite devastating. It can even be life-threatening.
Right.
The meninges can get affected like an aseptic meningitis. It's not infective in its origin.
So I also had aseptic meningitis.
So you can have that. Now the other thing that happens is when you treat these patients, you are using immunosuppressive drugs, which actually suppress the immune system. Now, unfortunately, we've not yet been able to find out drugs which can exclusively suppress only the abnormal part of the immune system, which is what is going haywire in these diseases. So it generally affects the entire immune system, so that even that part which is supposed to be protective is also deleteriously affected. The result of which is that you become prone to ordinary infections, which can sometimes be life-threatening. Right. So when you say aseptic meningitis, it can be part of the lupus process itself, or it can be an infective meningitis, which happens because you have suppressed the immune system in general, making you more prone to ordinary infections, which can become lethal.
Right, doctor.
But you can get an affection of the nerves, which is much more common actually. And the nerve involvement can be of different types. It can be a general involvement of the long nerves, but that is not the commonest thing we think of when that pattern is not what we think of lupus being the reason.
Right, doctor. And if I may add, when it comes to the nerves, when you talk about neuro, the first thing that comes to layman's mind is, okay, it's the brain, it's this part, this locality. And so when we would never link certain pains in the limbs or on the back to a neurological
Absolutely.
Condition. So what are the signs and symptoms that we can watch out for?
Essentially, the target of attack is often the blood vessels. And it is blood vessels of any system, blood vessels of any part of the body. But when it comes to the nerves, it is the blood vessels which provide nutrition to the individual nerves. So when there is a vasculitis, which is the commonest thing that happens, the blood supply to that particular nerve gets cut off. So rather than a peripheral neuropathy, which is a common manifestation, it's that it can happen in meningitis, in lupus also. But generally we have what is known as a mononeuritis multiplex. That means an individual nerve gets suddenly affected. It may be a motor nerve or a motor sensory nerve, as a result of which one part of the body starts getting paralyzed or partially paralyzed. And this can be in any part of the body. Over a period of time, multiple nerves can get affected and it may mimic a peripheral neuropathy.
Right.
Once in a way, it can present as a Guillain-Barré type of syndrome, where you have the problem with the insulation of the nerve, which is actually a fat covering, gets attacked, and the presentation is that of a total paralysis of the entire body. So these are the entire spectrum of manifestations. You can get it in any mix and match combination.
Right, doctor.
But as you mentioned, anything that affects the brain can be quite devastating, life-threatening, and therefore it will affect quality of life even subsequently, because recovery is not often total, and the disease process goes on still in spite of the recovery of an attack, and you need to have probably a very long-term control by treatment, and
right.
There can be flare-ups in the middle of treatment also.
Doctor, one of the diagnosing methods that is used in neuro is often an MRI or a CT, right? So are there other cost-effective ways, or should patients go with this particular method of diagnosing?
That would depend upon what symptoms you have.
Yeah.
Now, for example, if you have a stroke or you have a venous stroke, then an MRI is the only way you can find that out. Well, if the target of attack is the peripheral nerves, you don't need a scan for that, because the scan is not picking. You would have nerve conduction studies, you would have the autoimmune tests, which are blood-related tests. Then at an extreme stage, if you cannot really localize it, then maybe a nerve biopsy. But in that situation, you would not be really doing scans unless the affection is very close to the spinal cord, or the spinal cord itself is involved. Then once more we have to fall back on an MRI scan much more than CT scan.
Right.
One of the things that I need to mention here is that the venous strokes, which I mentioned, can be quite devastating, as I mentioned. It can be part of a general disease, or it can be part of what we call as an APLA syndrome.
APLA
is an antiphospholipid antibody syndrome, which can present as an isolated syndrome, which may not be part of SLE.
It could be independent of
SLE,
lupus,
but it could be part of SLE also. So APLA syndromes by themselves produce various other things, like for example recurrent abortions, venous strokes. You have venous thrombosis in various parts of the body. But we investigated, once we have that combination of symptoms and signs, we look for APLA. And then we find out whether it is part of an umbrella SLE, lupus, or whether it is an isolated.
Right, doctor. You mentioned about nerve study. When I had this constant nagging pain on my limbs, I felt like mosquitoes or ants were biting me, and there was some sort of a discomfort and pain in my scalp. I was sent to do a pseudo scan.
Yes.
So could you tell us about that?
Nerves are essentially of two broad types, the big nerves and the small nerves. It's easier understood that way. Now, the big nerves are the ones, as I mentioned, which have got this coating of insulation of fat, and they are known as what are known as the myelinated nerves, because the myelin is the covering that you have. Now, they convey the major sensations, like joint sensations, like vibration, which tell the brain the position of the body, and the brain in turn, because of the input, adjusts the tone of the muscles so that you are able to maintain posture and things like that. But certain other sensations like pain, crude pain, are sent to the brain by the low myelinated or small myelinated fibers or the non-myelinated fibers. We call them small fiber neuropathy. In a routine nerve conduction study which we do to identify the functioning of the nerve, it is only the big nerves with the myelin that it is picked up. The small nerve function cannot be picked up. The symptomatology is slightly different. The clues in examination are slightly different. And you have to do special scans like the pseudo scan.
So if you're talking about the small fibers, in what form does it start to manifest?
Yes. So generally it can manifest in different ways. It can manifest as tingling, as numbness, like the symptoms you mentioned. And then you would have some difficulty with dulling of pain or dulling of sensations, where you may have, whenever you have a neuropathy, you can have positive symptoms and you can have negative symptoms. The positive symptoms would be tingling and numbness, would be pain, would be a discomfort and things like that. The negative symptoms would be numbness or loss of sensations. But there the loss of sensations is not so much as with the big fibers. But and then the reflexes which we do when we tap the thing. In a big fiber disease, the reflexes would be absent. Here the reflexes would be present. So there are clues in the examination itself. But what is really devastating in the small fiber neuropathy is that these small fibers are also responsible for what is known as the autonomic nervous system. The autonomic nervous system is that part of the nervous system which is not under voluntary control, because it controls the most vital functions on which life depends. Like, for example, your heart rate, like your blood pressure, your temperature, how you need to change your environment internally to face a stressful situation.
Right.
That cannot obviously be dependent on voluntary control, because your life depends on it. It has to be automatically done. And the control of these, while coming from the central structures in the brain, are executed. The execution arm of it is much more through the small fibers than the big fibers. So when you have this small fiber neuropathy coming in, which can happen not just in lupus, it can happen in other diseases like diabetes or B12 deficiencies, sarcoid, so many other diseases also can affect the small fibers. But when it comes to any small fiber involvement, the predominant problem that you get has to do with the control of vital functions in the body. Like the heart rate can go up and down without there being any rationale to it. It's not dependent upon the environmental necessity. It can be blood pressures which go fluctuating. It can be sexual dysfunction. It can be problems with sweating, because that regulates your temperature. But much more it can be with blood pressure, where when you stand up, for example, you develop what is known as orthostatic hypotension. Generally, when you stand up, you're standing up against gravity. There is a momentary drop in blood pressure, but the correction is so quickly done that you don't notice it. And that is done through the small fibers. Now, when the small fibers are not functioning properly, that drop becomes exaggerated, and it can even lead to a presyncope or a fall, transient loss of consciousness, and so on. So it can be life-threatening in many ways. The bladder and bowel are also controlled by the system. So difficulty with passing urine, constipation is a feature. So the quality of life deteriorates tremendously, on top of which some of the events can also be life-threatening. Like you can have a silent heart attack without the pain as a warning.
We know many patients who have had silent heart attacks too.
So that's why when you have diabetes, which has been going on for a very long time, and you have the nerves getting affected secondary to long-standing diabetes, the warning signs of a heart attack are not there. The patient may die suddenly, either because of an arrhythmia, where suddenly the heart starts beating very fast, or just collapses and you have a failure. So this can happen in a small fiber involvement in autoimmune diseases like lupus.
Right, Doctor. Doctor, all of this can be so overwhelming. It's so technical, it's so intense. Can you tell us in simple words 5 or 10 symptoms a lupus patient should just watch out for, and if it manifests, they know they should meet a neurologist?
No, any unexplained symptom should obviously bring you to a doctor.
Right.
And
in our case, it would be primarily a rheumatologist.
See, it depends upon whether the person or the person who's with them would be able to recognize this as being part of a lupus syndrome, which is often what does not happen.
Right.
So you need to go to a physician who also knows about this enough to be able to refer it to a rheumatologist. You understand? Right. If the symptoms are very straightforward, like it is involving the nervous system, now obviously people would be more aware of that and they would approach a neurologist. But from the neurologist's point of view, we need to look out for red flags to look for an underlying lupus or any autoimmune phenomenon which may be responsible for the neurological symptom. There, as I told you, the red flags would be a younger patient, whether there's a previous history of anything that suggests, the joints getting involved, a weight loss of recent onset, whether there would be fever which is going on for some time for no other, without any particular explanation, and no infective focus is found. When you have other involvements like proteinuria in the kidney or some other system is involved, or the skin gets involved, very, very common. So you have these rashes on the body, what are known as the malar rashes and things like that. So it's really for an intelligent, good physician to put it together and think of the possibility of some underlying disease like this. But these would probably be the red flags. Younger patient, oddball symptoms, multiple systems getting affected, symptoms going on for a long period of time. Cognitive thing can be part of the vasculitis, where you have small fiber, the blood vessels getting affected, small strokes getting affected. Migraine can sometimes be a symptom. And like you mentioned, there can be neuropsychiatric manifestations, where you have, the mind is part of the brain. And the way we behave in a certain set of circumstances, the way we respond, is modified by inputs and the circuits of the mind.
Right.
Now, if you imagine that the same can happen in other parts of the brain, you imagine the circuits of the mind getting affected. And then it becomes very simple to understand that you have a psychiatric manifestation.
Right.
Which can be oddball behavior, which can be withdrawal, which can be depression, but more often than not, psychosis, where the patient behaves abnormally. One clue may be that you have a patient who, for no rhyme or reason, has never had a history of a psychiatric illness before, like a bipolar personality or a bipolar tendency, having for the first time neuropsychiatric manifestations, especially in an older age group. The general dictum in neurology or psychiatry is that if you have a psychological or psychiatric symptom which comes on for the first time in an older patient, that is organic. That means there's something wrong with the brain which is responsible for it. It's not a psychiatric condition in its sense.
Right.
This is really what. And so when you have those kind of symptoms, and you have a background of other symptoms which involve other systems, which involve over a period of time, there's a waxing and waning involved, there is a fever which comes on without any particular infective focus which can be identified, those would be the red flags which would indicate that there may be an autoimmune process brewing, and that would be responsible. But it requires, first public knowledge, which you are obviously doing and disseminating. So the more people are aware of it, they would approach the appropriate doctor. We are lucky in Kerala because people are much more aware of all these things than because of literacy, because of the media, because of exposure, travel, so many things that make it, put us in an advantageous situation. But it should also involve physicians who are very well trained, better trained, to be able to identify these early, because early diagnosis makes a huge difference in outcomes. When you get it, when a complication has occurred which is irreversible, then you're dealing only with the complications, and then it becomes you're catching up, you're not preventing it.
Doctor, thank you very much for doing this. Thank you for guiding us and our community.
My pleasure. Thank you so very much. It's been a pleasure interacting with you.
Thank you.
Thank you.